Show us your rebel pose. Hi, everyone. My name is Sachin Jain. I'm the president and CEO of Scan Group and Scan Health Plan, and I'm also the rebel in chief. All right, I'm told that I have to dive into the cup and answer questions one by one. So what inspired you to pursue your current career in healthcare? This is a really interesting one. When I was growing up, my father gave me two options. He said, you could be a doctor or you could be a physician. And ultimately, I chose physician. And that said, I wanted to make my career my own. And I've always been interested in larger societal change and how to make the world a better place for more people. And so I really wanted to blend a career in medicine and healthcare with a career in driving and creating social change. If you could switch careers for a day, what job would you try and why? I'm going to confess something to you. My career in healthcare was really a second choice. The first internship application that I ever wrote, it wasn't an application, it was actually just a cold letter to an executive, was a letter to a guy named Brian Cashman. Baseball fans will recognize him as the general manager of the New York Yankees. But in the year 1999, as my college freshman year, I wrote him a letter and I said, you started your career with the New York Yankees as an intern, and I would like to start my career with the New York Yankees as an intern. Most people don't know I wrote this letter, so this is one of the first times I've confessed this in a broader setting. He never wrote me back. And so what could have been? I could have been an executive at the New York Yankees, or at least an intern, but no one ever responded to my letter. Thank you so much, Brian Cashman. What do you think is a rule that should be abolished? Is this a society question or I think we need to relook at HIPAA. This is kind of a crazy one, but I see all these interpretations of HIPAA that are, which is a law that was written in the 90s, that kind of make it hard for healthcare organizations to text patients, or send them emails. People have to send information through secure portals. And I think we should just be rethinking, our communications rules for patients. I think I would look at HIPAA. That would be my suggestion. What's a rule you love breaking? So I would tell you, I'm not going to tell you. So what draws you to serve in the not-for-profit sector? So I spent over a decade working at Fortune 50 companies, and they're incredible environments. But I would say at the end of the day, the goal quarter after quarter in for-profit environments is to deliver profit and margin to shareholders. And I think one of the most rewarding things about leading Scan, which has been a not-for-profit organization since it was founded in 1977, is the fact that on the margins, we actually make our decisions through the lens of what's right for our members. And that means, there's going to be some years where we make profit, some years where we don't make profit, because we're always thinking about impact to the member. And, I think that we're at a moment of crisis in American healthcare where people are really reflecting on, should people be making profit off of health and illness? And I think there's a lot of people with very mixed feelings about that. And I think the nice thing about coming to work every day at Scan is I can do so with moral clarity about why I'm here and who I'm here for, which I think is just, on a lot of levels, very gratifying. What's something on your career bucket list you haven't achieved yet? I don't actually believe in career bucket lists. I think, when you have a career bucket list, you end up chasing goals that sometimes might be obsolete. Like the things that I wanted to do when I was 25, by the time I was 30, I realized I didn't really want to do them. So my career goals, are pretty dynamic. They don't stay static. They really change based on the lessons that I learn in through previous experiences. And I would really encourage, everyone out there to think about a more dynamic view of career goals that gets refreshed based on new knowledge. What's some of the best career advice you've received? it's actually not career advice, but it was a career observation. And this came from a guy named Jim Young Kim, who was the founder of Partners in Health. He was the chair of the Department of Social Medicine at Harvard Medical School when I was a student there. And I remember when I was working closely with him when I was a medical student, he turned to me one day and he said, you're a talented guy. What do you want to do when you grow up? I don't really understand you. And I said, I'd love to run a hospital one day. And then he turned to me and he said something to me that surprised me and shocked me, and which I've now repeated to other people since then, which is, he said to me, that's not particularly ambitious. I would expect more from you. And I thought at the time, like, wow, like running a hospital, that would be a super ambitious kind of end to a career. But I think his point to me at the time, which is something that I think was just incredible advice, was to really be thinking bigger. I mean, we have one life to live. We have singular opportunities to really change the way people think about things, change the way a certain set of problems is solved. And I think it prompts good reflection. I think we should all try to be a little bit more ambitious no matter who we are. Show us your rebel pose. No, I don't know. I don't have a... That was me as Chewbacca.